You are listening to I Am Refocused Radio with your host, Shemaiah Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shemaiah Reed.
Welcome back to I Am Refocused Radio. Once again, we are here today, and just like any other time, we have another show lined up for you guys today. We are talking to Dr. Peter Kowey. He is a world-renowned cardiologist, a researcher, and author whose new book, Failure to Treat, exposes how you can learn a better opportunity to understand what you don't know. Because, man, we all have blind spots. We all have situations where we just don't understand a lot of things. Well, that's why we have people like Dr. Peter on the show. He's an expert in his field, and he's going to help us understand a little bit more better about American medicine and the health industry, because it's kind of timely. If you've been watching headlines lately, let's just say there's probably a lot of stuff we can talk about. But today, I want to welcome Dr. Kowey to the show. First and foremost, thanks for taking time off your calendar to talk to our audience today. How are you doing, sir?
I'm doing well, thank you. And thanks very much for the invitation.
Yes, sir. Let's talk about what are some of the things that you're seeing in the health industry. What's some of the things that maybe concerns you, maybe with patients versus practitioners? Kind of lay out for us, what are some of the things that you're seeing in the moment?
Well, as you said, it couldn't be more topical, because I think people now have to pay attention to some of the things that we've been worried about in medicine for several years. I guess number one on the list is the cost. We spend about $4.5 trillion on medical care in this country every year, and I'm pretty sure nobody thinks that they're getting their money's worth. Most of us are very unsatisfied. Yeah. Even people who are relatively well off complain about long wait times, the inability to get to consultants, trying to understand this very complicated medical insurance industry and how to get coverage, pharmaceutical costs. There's just a myriad of things that everybody is suffering with. But in particular, and the thing that's really most aggravating is our underprivileged people in lower socioeconomic strata who struggle very hard just to make a living, and are now seeing their healthcare coverage challenged. And if the bill that Trump signed goes through, revoked altogether, they won't have an opportunity to have any health insurance at a time when we're most worried about common diseases. So I think that probably is the thing that worries me the most, is cost and access to medical care being challenged.
You write about insurance denials, drug overpricing, and fragmented care. We all, well, I can't say disclaimer, but a lot of us know too well. You go to your appointment and you're in and out. It's 1, 2, 3, ABC, and boom, time is up. Gotta go to the next patient. From your own perspective, which of these issues do you see are destructive most to families right now?
Well, again, you're providing a tremendous amount of insight in your questions, because I think one of the root causes of the problems that patients have with their physicians is the 10-minute appointment. I mean, that's what most primary care doctors have to see a patient, 10 to 15 minutes of time. And you think about that for a minute. I mean, it's totally ridiculous. How can you possibly sit with a patient, many times you haven't seen in a year, with 4 or 5 medical problems? They're diabetic, they have hypertension or high blood pressure, and they also have arthritis and a bunch of other stuff that they want to talk to you about, legitimately need to talk to you about. And as you said, you're in and out in no time, because you know that there's a waiting room full of patients. And if you don't move quickly, there'll be people complaining in the waiting room about how long they're waiting. So we're rushed. We don't have time to talk to patients. We don't have time to think. Doctors don't have time to read. They don't have time to keep up. I mean, the time crunch for practitioners, not just doctors, but nurse practitioners and physicians' assistants and nurses, the time crunch that they're in is just hard to describe how bad it is. So what we talk about in the book are ways of trying to at least become more efficient in the way we deal with our practitioners. One idea, for example, in the book is when you go in to see your doctor, make sure you have your questions written down so that you can be efficient in asking the questions that you need to get answered. And maybe in situations where there's a serious illness, bring somebody with you to the office visit, because you can't remember everything that the doctor throws at you in a few minutes time. But there are solutions, at least partial solutions, to some of these issues that we bring about in the book.
Once again, listening to Refocused Radio, watching us online, talking to our guest today, Dr. Peter Kowey. You also talk about how burnout in the lens through the actual provider, the great doctors out there who are working tirelessly, crazy hours, and they're trying their best to balance the truth on both ends. You have certain things you have to follow from this side, and you have a patient that needs you. And there are great doctors out there who are still dedicated to providing medical care that they're extremely passionate about. But when you look after decades of training and mentoring fellows worldwide, what do you think has most changed in the profession and how that contributes to the crisis?
Well, I think part of the problem that we have is that there's been an increasing emphasis on tests and procedures. Doctors now get paid when they do procedures. They're incentivized to order a lot of tests and do a lot of procedures. They're not incentivized to sit down at the patient's bedside and have a conversation and find out what's really below the surface of their complaints. What are the real life problems these people are having? And when doctors try to do that, and many of us still can struggle with that, it creates a time crunch that we just talked about, because you don't have the time to do it. And if you continue to do it, many physicians, unfortunately, do experience burnout. Burnout is it's a very hackneyed term. We throw it around, but the truth of the matter is, what it means is that what physicians and healthcare providers do is they look for ways to get out of their profession. How can I change my life's job so that I have good life-work balance? I can spend more time with my family, for example. Because if you're really a truly dedicated doctor and try to spend as much time as you can with the patients who need you, it is a very difficult proposition, and it leads to people becoming very depressed. We've seen an increase, unfortunately, in suicide rates in healthcare professionals, especially in people in the highest pressure jobs like ER doctors, for example, who are under an enormous amount of pressure when they're working. The psychological stress here is really significant.
When you think about media and how you can watch things on like C-SPAN and see testimonies being given, and one thing that seems to be common throughout the years is how complex the issue truly is. It's not just a one thing and boom, you fix that one thing and naturally the health system is amazing for everybody. Well, it's very complicated, and it has, I would think, from an outsider looking in, a lot of things that we have to understand. But from a professional lens that you can come from, what are some of the pain points that you're recognizing that consumers may not really truly understand?
Well, you're absolutely right that there are a myriad of problems, and one of the problems I had when I wrote this book, which is 20 stories of real stories, true life stories of people who have been harmed by the healthcare system, practitioners as well as patients. But one of the problems I had was every time I would start to talk to somebody else about the book, they would tell me another story, and I could have gone on and on with this thing. At some point, you had to cut and bait, but the truth is that there are a couple of things that would really help a lot. One, and I know that there's a lot of controversy about universal health care, but we need to be able to provide a basic level of health care for everybody in our country. Every citizen should have the right to have basic health care. And that may not necessarily be all the bells and whistles, but the ability to see a primary care doctor on a regular basis, or to seek emergency care without having to worry about how to pay for it, preventative care that would really make a major difference in the incidence of common diseases like stroke and heart attacks. These things really need to be provided to our citizens. And in other countries where these services are available, outcomes are so much better. I mean, we have not done a very good job of reducing infant mortality. Our life expectancy in this country is ridiculously low for the amount of money that we spend on medical care. There are things that can be done, but the only way they're going to happen is if we pressure our legislators to enact legislation that allows for some of these things to happen. And I'm very hopeful, by the way, after the results of the election a few days ago, that perhaps in 2026 we will see people galvanized about this and willing to vote with this particular issue in the front of their mind.
When you think about the corporate handprint, if I could put it in that light, there are a lot of things going on with corporate takeovers in medicine. When you look at how that's being done, what are your concerns and what are some potential red flags?
Yeah, so the incursion of private equity in particular into medicine, which has become rampant, has had a very negative impact on the quality of patient care. What has happened with these large corporations becoming involved is obviously they don't really care about patients. I mean, their mission, their goal is to make money. And the way to make money in medicine is to turn the crank, to do procedures, as I said earlier, to order a lot of tests, to do things that in some cases may not absolutely be necessary, but do generate revenue. But really, the other thing that the private equity incursion has caused is hospital closures. You've seen several hospitals in our area have closed. And when large hospital systems close, it places an enormous burden on what remains, the healthcare system that remains, the people who are still there. It places patients in healthcare deserts where they can't access medical care. Even if they wanted to, they have no place to go to get medical care. And it also drains a tremendous amount of money out of the healthcare system. The billions of dollars that are being made by private equity firms coming right out of the pockets of patients and practitioners. It's an egregious situation. And again, regulating private equity as it relates to healthcare is a very high priority. And our legislators so far haven't really taken any kind of action in that regard, but it's something that's absolutely necessary.
Once again, listen to Refocused Radio and watch us online, talking to our guest today, Dr. Peter Kowey. My next question has to do with technology. There are a couple sides, maybe there's more than two sides, but currently I'm seeing two sides of people who love this AI stuff, and it's like helping with flow and helping with performance and organization, blah, blah, blah. But there's also concern that's legitimate. There's also ethical concerns that maybe this AI technology tools may not be the actual winner chicken dinner, if you will. It's more like there could still be some bad actors that are behind the codes.
Yeah, I think you're absolutely right. It's the good and the bad. There's obviously some very big advantages to implementing artificial intelligence into clinical medicine, but there are many landmines out there. And I just don't have the feeling that we've thought them all the way through. For example, there's a big push now for diagnostic tests like X-rays and electrocardiograms to be read by artificial intelligence. I don't really have a problem with that, but there has to be an overread. There has to be a human input into that interpretation, because there's so many subtleties in these tests that I know that intellectually you can make the diagnosis, but how to put that in the context of the patient's overall management is really not up to AI. It's up to the doctor. So the technical part of it may be helped with AI, but the overall interpretation and how it's implemented in the patient's care has to continue to be the physician's responsibility. Another place where I've seen discussion about using AI is in this, the thing that you mentioned a little bit earlier about denying coverage for tests or for treatments. Insurance companies are beginning to implement AI to do that. Now, think about the enormity of that. So your doctor orders a test because the doctor thinks you have some important disease. and some AI instrument in an insurance company turns you down. Now, the insurance companies have said, well, there's going to obviously be some kind of human oversight, but is there? And what is it going to be like? And how quickly will it be implemented? I think that, as I said, I think you can't turn away from this. AI is coming and it's got to be dealt with. But as physicians, we have to continue to insist that it is subjugated to us. We are the principals. AI is the helper, not the other way around.
Yeah, like I hear a lot of times with people in the tech world that when you think about ethics, it is not the replacement, it is a helper, like you said. Because if you treat it as a replacement, who's to say that, I'm not saying it will happen, but who's to say you can rule out that there can be a situation where the patient is wrongly labeled as something because the AI says so? I mean, it hasn't happened yet, to my knowledge, but it could very well be.
Absolutely. Well, we're already using an AI technology for interpreting electrocardiograms. In fact, before I came on the air with you, I was over-reading the interpretation from a computer of electrocardiograms. I would say at least 20% of the tracings were not completely interpreted correctly. There were at least some things that I needed to add or subtract from the interpretation. It was nice to have it, something in front of me to edit. That was nice, but to let it go that way, it could have had enormous implications in terms of patient care. Some of them were reading heart attack patterns on the electrocardiogram that weren't there, for example. So there's a tremendous opportunity here for harm, not necessarily even physical harm, but psychological harm. When patients go on their charts and look at test results, and they start reading this stuff and they don't really know what they're looking at, and they can't get to the doctor fast enough for them to give the interpretation or what that really means. I can tell you my patients go crazy over that stuff. And now we have the opportunity, if AI does take over, for that to multiply and become even more difficult.
I don't even want to add to what you're saying, that we need to sip it like water, because too much AI, the consumer can try to diagnose themselves as well. Say, well, AI told me this is what I have, or this is what's going on. So I can see that being a tug of war in the future. And if there's no checks and balances, power might kind of be placed in the wrong arena, so to speak.
Well, we've been dealing with the internet, Dr. Google and all that other stuff for, a few years. And most patients use it in a reasonable way, sort of just to get some information and don't get too crazy about it. But there are some patients who really get taken down the wrong path with it. And I can tell you that in the office, I sometimes have to spend as much time trying to persuade patients that what they read on the internet was not correct as I do trying to give them the right information. I'll tell you where this has really become a problem is with vaccines. I mean, the amount of misinformation about vaccines that we've seen now, and the ramifications of that are people not getting vaccines. It's a very, very large problem, and in clinical practice as well as in public health. So, yeah, there's lots of opportunity here for issues.
You can watch I Am Refocused Radio and listen to us whenever you get your show or podcast. We are talking to our guest today, Dr. Peter Kowey. My next topic is healthcare deserts. You also highlight devastating effects of limited access. We kind of breezed through that in the early intro. But when you think about, especially in rural areas, can you share a patient perspective, if you will, without naming names? What is some of the potential risk of having to have that problem? Well,
we are creating these deserts as you said, in rural areas as well as in inner cities. And what it means is that, there's several different ramifications. One is, it's just hard to find a doctor. I mean, if the health system goes down and they've employed physicians, those physicians may go away and you lose contact with your primary care doctor or your consultants. But in addition to that, what's even more frightening is the inavailability of emergency services. So in the book, there's a very sad story about a baby that was being cared for by her parents. They moved to a rural area, an area outside of Philadelphia, as it was. knowing that they had a hospital that was literally within 10 minutes. The baby had a congenital heart problem, but it wasn't, at the time that they moved out there, the problem wasn't terribly severe. But one night the baby gets into trouble, they get in their car and they drive to the hospital where they think they're going to get their care, and they pull into the emergency department and it's closed. And they then have to drive another 20 or 30 miles to get to the next hospital, which is understaffed and basically don't have the facilities to take care of the baby, and the baby ends up dying. Anonymized true story of what happened to a very unfortunate couple who inadvertently moved into an area that they really couldn't access medical care. It's not going to be unusual. Hospital closures are happening around the country, and the reason is because hospitals are operating in the red. There was an article today in the paper about what will happen if all the subsidies from the Obamacare go away. Not only will patients be in deep trouble, but so will hospitals, because they're going to be confronted with an increasingly large number of individual patients who don't have insurance or don't have very good insurance. The hospitals can't turn them away. I mean, that's illegal. So they have to admit them to the hospital and absorb the costs. You can see where that would put hospitals in great financial jeopardy and increase the chances of their closing. So this is a real problem, and it's going to be exacerbated with the changes that are occurring with reimbursements.
You've also served on FDA advisory committees and seen healthcare policy up close. Looking through that lens, what disconnect have you seen or discovered between regulation and actually what really happens to patients on the bedside?
Well, we're creating a wider and wider gap between high technology medicine and everyday problems that patients have. So we can treat rare diseases with genetic changes and genetic manipulation. I mean, there's all kinds of things that we can do with T-cell vectors, CAR T, and all this other stuff that people talk about for advanced disease. But we're not spending enough money, and we're not giving enough emphasis to garden variety prevention. One example is high blood pressure. High blood pressure is rampant in the African American community, as is type 2 diabetes, by the way. And these are diseases that are extremely well treated and simply treated with cheap medications. If we allocated resources more in that direction rather than spending so much money on high technology issues, it would save literally thousands, if not hundreds of thousands of lives. So it's a maldistribution of resources that I've seen at the regulatory area. More and more companies interested in coming up with drugs for uncommon diseases like myasthenia gravis, for example, or ALS, which are important diseases to treat. But if we refocused on the common diseases and prevention, we can have such a major impact, and we could benefit a much, much larger number of individuals.
As we wrap this up, you also warned that American medicine could completely go off the tracks if we don't act. We know that time is very valuable, but it is important. Timing, if you're too late, it might be a lot worse versus if we would have acted a lot sooner.
Yeah, I think we still have an opportunity to put things back on track. But the disconnect we have between our legislators and our professional organizations, they're not talking to each other. The legislators don't understand what's happening in the common medical area. One of the things that we're doing, by the way, with my book is we're sending a copy of my book to everybody in Congress, senators and House of Representatives, going to get a copy of it with a cover letter saying, read this because you need to understand that we are in deep trouble. And time, as you said, I completely agree. Time is really of the essence. We need to do something soon, or there's going to be literally hundreds of thousands of patients in the United States, citizens, our brothers and sisters who are going to be in major trouble.
You think about the next generation of providers, of young minds that are pursuing medicine, despite all the dark gray clouds that seem to be in the forefront, what's some light that you still see available for them to still be encouraged to pursue medicine and work their careers in service of helping those in great need?
Well, I think that's one of the wonderful things about medicine is you take the number of young people, very idealistic, who really do want to help people. And unfortunately, the medical education process sometimes turns them into creatures that I don't recognize anymore. People who are much more interested in how much money they can generate or what they can do with their professional career, and they lose contact with the patient. They lose the ability to sit and talk to a patient. One of the things that I talk about in the book is touching. I can't tell you how many patients tell me, the doctor came in the room and talked to me and then never examined me, never put a stethoscope on my chest, never did anything, never had physical contact with me. That physical contact is so important. It's part of the healing process. We need to educate our young people to preserve their idealism and to do medical care the old-fashioned way, holding hands and healing.
Once again, in this I Am Refocused Radio, watching us online, talking to our guest today, Dr. Peter Kowey. Like always, want to say, appreciate you clearing your calendar, but if there's something that someone watching or listening can do to stay in contact with you, what's the best website or social media they can follow you on?
It's Peter, PeterKowey, author.com. It's our website, and it has a lot of information about the book as well as the issues. And there's also a chat opportunity so that we can interact. If people have questions or things that are on their mind, I'd be delighted to have them visit the website.
Like I always want to say to you, appreciate your time.
Well, it was terrific. I appreciate your sensitivity to the issues, and your questions were very well focused and on point. Thank you.